Okay, so we are doing a revision on forearm technique, right?
Yeah.
Forearm, have you done elbow as well? No, not really, okay. So I will start with forearm and then we'll do elbow, okay? So tell me a few things. First, who would be benefit from elbow or forearm techniques?
Work deeper.
People with bigger muscles?
Work deeper.
Work deeper, bigger muscles.
Anybody use a lot with their hands?
Yeah, so if your hands are tired, yeah.
And if you're not very strong like me.
Oh, I'm not sure. Okay, good.
I am
All right.
strong, but I like
So,
it.
I'm going to show you a few things, okay? First, I'm going to show you F-low forearms. Okay, you know what is F-low forearms? F-low with forearms. Okay, so you can do a hold. Yeah, very nice hold. And the feel I want you to have is Friday night and you're drunk on the bar.
That's last night.
So relax your head, relax your hand, relax your shoulder, relax your weight, and all you do is just bouncing your weight a little bit forward.
Having your bronch in your arms and your hand.
Okay, really relax, okay? Then you're coming to here, taking, and, can I do that? And now you need a little bit more oil, but not much, and you're starting with forearms. Yeah? So you can do that to the side. And what I want the camera to come from the side maybe, because what I want to see is the movement of the body, yeah? So you're moving forward and backward. Yeah? And then you can do side to side. Yeah? You can travel with it to the other side. So it's an effleurage really, but very easy. Now when my hands are here, when I finish the forearm, I continue with my arm. Yeah? So here, forearms, hands are really loose, and then arm.
So you're not applying a lot of pressure, are you? With your forearms?
No.
It's quite
No.
light.
But
Your
now,
weight, just your weight.
now you can start applying more pressure. So this is just effleurage, okay? And you can do that. You can do that with your hands the other way. Okay? And you really need to feel, okay, here, I need to work more in here. Okay. Then I want to start work deeper. Okay? Now, you need to come fairly close because I need to ask you a few questions. So if let's say that my forearms is exactly above my weight. So if I press down, my forearm would go this way, that way, or stay exactly down? Stay exactly down. Good. Now my weight is to this way. So this is my weight and this is my forearm. So if I press, where is the forearm going to go? This way or that way? Forward, right? Good. So if I'm now this way, where is the forearm going to go?
It's going to go down.
Down.
It's uncomfortable.
It's uncomfortable, isn't it?
Use the other arm.
So what I want to show you is actually when you're massaging, I see a lot of people doing the forearm this way. It's very uncomfortable. What you need to do is the forearm is forward, your weight is a little bit backward, and then you go forward, okay? Now, the forearm it should be an automatic technique, which means only your body allow it to move by yourself. You don't need to do any of this. Remember the effleurage we did this way? It's not that way. Forearm, it's not this technique. It's that technique. Again, I'll show it to you again, okay? The forearm is nothing to do with moving your shoulder. it's moving your body with it. Okay? Now, where do you put your body? Would you put your body there or there? It's
Closer.
different. Okay? So, let's start. You start really slow. Now, when you work deeper, you need to be a lot more sensitive because it's a stronger technique. So you need to take the time. Take the time and arrange yourself. Okay? Then slowly sink in. Slowly sink in. Good. Now move your body backward a little bit and just let it go. Let it go. Now it starts moving by itself. Now, yes, I need now to move a little bit more.
Yeah, fist. Not fist.
Ah.
His
So
hand's
that is
relaxed though.
quite relaxed, yeah? Very relaxed.
Start like this.
Okay, quite relaxed, and once in a while you move.
So using
So actually, I move, the only way I move, can you see, maybe the camera should see my leg, so come a little bit, yeah? The way I move is I sink, and then, because my body is backward, it starts to glide, but allow it to glide by itself. Stay there, allow it to glide by itself. After a while, all I do is just that, and it moves, okay? And a little bit there.
Like moonwalk.
Come on. Okay?
Yeah.
Or you can do it in a different way. You can do it this way, but what I find that when you start moving,
You're a bit jerky.
you're jerking it, yeah? Okay, so let's try the other way. Now, some students ask me which hand I should have, this way or that way. I would say the hand that is more comfortable for you. So if you're not sure, try one, try the other, and then, yeah? So again, going there, slowly sink. And when you're sinking, sink in.
with this hand, what are you doing with the other hand? Are you pressing?
I press it, I press down a little bit.
Okay.
And then I allow it to go, and then wait, and then it moves by itself. Yeah? Then you
Almost
can
with
move
the
in
client's
here,
breath. We talked about that one.
and then I move that in here, because I'm in between the scapula and the shoulder and the spine, and then I go down. Okay? If I want to change, if I want to come from above, so you can come from above like that. Okay? So let it stop and see where you are. Now you might need a little bit more pressure, and that's it. Now it moves by itself. So it's actually very slow.
So would you say this technique would give you a little bit more pressure than using your hands?
Yeah. Now, if I do that quickly, it would be too painful. Now, I feel the movement, and the client feels the movement, but no more. You don't need to do more. Should we practice? Yeah.
You finish.
So-
Finish in there, not going like.
You can, or you can do it this way. Yeah, you can. So what I want you, feel the position. Feel the position. Feel this relaxation when you do it. You see, I'm not sweating. It's easy. It's very, very easy. Make it easy for you. If it's gonna be easy, it's like metal but feather. Yeah, that's what you're trying to do together.
Thank
Good.
you. Bye-bye.
What are we going to do now is to extend beyond the basic forearm, and we're going to work into different areas. As you can see that you can do quite a lot with the forearm, and as you felt, it's a lot easier. You can cover a bigger areas, but you need to work the mechanic of your body better and to learn it. It will take some time. Okay, first of all, before you actually start, you can do nice holds with the forearms and with the elbow. So you can put one hand on the glute area, one hand on the thoracic spine, and what you do now is kind of stretch that area. And move it a little bit. You can do a nice movement here. Yeah? You can do here and on the leg. You can do on both gluteal area. Good. Now, working with the elbow. So you can work on the elbow in few ways. Unlikely that you're just going to do that, because it will be quite painful. So you can start with the elbow, working on the forearm, and then just lift your elbow a little bit. Sorry, lift your forearm a little bit. Or start directly with the elbow, and then you might need a support. The support you need is you put your hands this way and you put the elbow as close in, and that would avoid your hand gliding to the side, okay? So that, can I undo the bra? Yeah. Let's take that, a bit of oil. And what I will do, I'll start actually with the shoulders, okay? You can come on up. Can I borrow a chair? Someone? Yeah, thank you. Take a chair. And I just want to show you how nice you can do that while sitting. So you can come to here and put the arm this way. All you do is just to really lean onto it. Yeah. It will be easiest to do this way. Yeah. You can move your chair a little bit. And actually, if you see my leg, one of the leg goes backward. So it actually gives me the oomph to go forward. Yeah. Alternatively, leave the chair. You can do it without the chair, because sometimes you just want to do it a quick one without sitting. And what you see that I do with the other hand, I just stretch the lower back. Good. From here you can continue on the shoulder. You can do both hands on the shoulder. So one on the erectus, one on the trapezius, one on the side. Yeah. Can I have another towel this way? I'm going to show you a lot more advanced stuff while we go. You can create a bolster. And now I want you to see fairly closely, because what I'm going to put the bolster is underneath the shoulder here. Like that. You see? So now can you compare this shoulder to that? This shoulder is a lot more backward, raised. And what happened to people who come with the shoulder forward, you put them, and it, by itself, it's kind of stretched there. It's retract the shoulder. Remember retraction, protraction? So if somebody's coming with the shoulder this way, you can just put them with two hands, with two of the shoulder. And you need to put it quite in, and it helps just by the position quite nicely. And then you can work with the... So you can work with two hands, one on the upper trapezius, the other one on a little bit on the scapula, and you're kind of pushing the scapula down. Okay? Then on the other hand, I'll show you some of the arm technique. You can bring the arm. And you can start with the hands, but right away you continue with the forearms. This one is really nice for people who had some RSI on the wrist. So
It's really nice. This one.
yeah, you can work slowly, working on the triceps, or do two hands together. Good. And I'm going to leave one hand this way and the other one the other way, and I'll ask the student after how is it, if they feel any difference. Okay. Then coming to the legs. Yeah. Right. Tuck this under. Here on the legs, because these muscles are bigger, you can use quite nicely the forearm and elbow technique. I mean, you can start on the gastrocnemius. You can have two hands like that, and then you do both sides together. So I do that, and then the muscle fits right in this area in here. Yeah, you can do pretty much the same thing into here. So actually, it's almost like working on the adductor, hamstrings, and almost onto the iliotibial band, almost at the same time. Yeah. If you're not fond of this, you can just work on one at a time, this way, and then on the hamstring. Yeah. Or you can do that one. Good. Then working on the iliotibial band. Yeah. You're taking the knee a little bit to the side, and then you're relaxing it this way. Yeah? And what you see that it comes more outside. I mean, without the turn, it's quite low. With the turn, you can come and work this way. But warning, it might be very tight and very painful, so you need to work slowly. I would do starting this way, starting with the palm, then going into the knuckles, a lot slower. How is it? It's painful, or?
Maybe too much pressure, but
I like it.
Yeah, okay.
but anyway, I like it.
Is it too much?
A bit too much.
Really?
So work fairly slow.
A bit too much.
Slowing down. Okay. Okay. And then you can do the same on the gluteal area. You can start with knuckles and then use your elbows here. That's very good because this area has a lot more, few layers of muscles. So it has the gluteus medius, maximus, and minimus, and below that, if you heard about piriformis muscle and quadrifemoris, with our deeper muscles that help in turning the hip. Good. So when to use it? You're tired of using your hands? You want to give them some break? Or it's just too much and the whole muscle is tight? You know, if you have one compression here and there, it's okay. But if you need to do a whole muscle compression, then it's very hard. So you prefer to do it this way. Very slow. Okay. Let's do some elbow. What you don't need a lot really. You really don't need a lot. What you need is start with the forearms, and then if you feel an area that might need a little bit more, what you're doing is just flexing your elbow a little bit. And that's it. If you want a light movement, and then that's it. Yeah? If you start doing that, you probably do too much. Yeah? Because you're just irritating the muscle and it's contracting, saying no thanks, you know. That's painful. Should we give it a try? Yeah? Work other areas, because I think massage therapy is concentrating too much on the back, with the elbow and forearm. So you need to do the rest. Yeah, need to do the rest. Okay. Now let's. I'll ask Intari after, but also, can you give